I will. I will. I'll send it to her after, Sandy. Okay. Hi everyone. Ashley, you can unmute yourself. Just to update you, they can hear us, but we cannot hear them. So, we're going to go through our whole presentation, and at the end, I'll call Sandy back and we can talk about any questions towards the end. I'm just going to share my screen if it would let me. Okay. It's going to make me quit WebEx. Are you able to share the screen by any chance, Ashley?
No, I have to do the same thing. I just tried.
Okay, I'll be right back. It's going to make me quit out of the app to now share my slides. Okay, let's try this again. Can you see my slides now?
Hmm.
Okay, great. Um, I don't know why. Oh, Jesus. This is my first time using WebEx, so bear with me. Okay. Does everything look okay, Ashley?
Yeah, it does.
Okay, awesome. So just to introduce ourselves, I'm Taylor. I'm the current outreach officer of Echo, or I guess the 2023-2024 outreach officer. I'm a second year medical student at Einstein, and I'm going to pass it over to Ashley Lee, who will be my successor this year.
Thank you. Hi everyone, I'm Ashley. I will be the point of contact going forward. So, very excited to be here. I am a first year medical student at Einstein, and I'll be starting off this presentation about Echo. So the next slide is a brief overview of what we're going to be talking about today. And we will start with what is Echo and give you a general overview of that. So ECHO stands for the Einstein Community Health Outreach Clinic. We serve patients who are uninsured in the Bronx. So this includes many immigrants, low income, and Spanish speaking patients. And ultimately, we are trying to transition them over to long-term care. Our volunteers consist of medical students of all years, so first to fourth, as well as MSTP, so MD, PhD students, prep, and pre-health students. So it's a collaboration between students of all degrees, and we're collaborating mainly with the Institute of Family Health. That's where we operate. So every Saturday from there, we see about 30 to 40 patients. So adding up since January 1st, we've seen over 1,500 patients at the Echo Clinic. Um, and at the Echo Clinic, our mission is to provide free, high-quality, comprehensive healthcare to the community in the Bronx who is uninsured. And overall, we're also trying to establish the continuity of care for this demographic. In the long run, our vision is to be a leading model of this accessible, compassionate healthcare in this community through our services, to bridge healthcare disparities, promote health and wellness, and improve the quality of life regardless of anyone's circumstances. And we are located at 1894 Walton Avenue in the Bronx, and it's accessible through various public transportations, and our volunteers are provided transportation to and from the clinic as well. In general, we accept patients from 8 a.m. to 12 p.m. every Saturday. So our team here are it's the beautiful faces on the screen. We have our clinical and preclinical board. So two boards that are overseen by our medical directors, and we all coordinate together with the volunteers to ensure that the clinic is running smoothly. The clinical board consists of third and fourth years, while the preclinical consists of first and second years, and we kind of divide up the roles to make sure that the clinic has it's fulfilling its needs. And then our two medical directors here are Dr. Curtillo and Dr. Nozal. They, of course, oversee the boards and make sure that the continuity of the clinic is present as we transition each year, such as with me and Taylor. And they are also our point of contact with the Institute of Family Health so that we're staying in touch with that clinic as well.
Okay, so talking a little bit about the care model at Echo. So we operate on a transition to care model where we provide either two or four visits to patients, depending on what conditions they come in with. Our general eligibility criteria is that we see patients who are over 18 years old, do not have insurance, are not pregnant, or not HIV positive, because pregnant and HIV positive individuals qualify for certain health care in New York State. So we can help set them up with that if they are not meeting our criteria for our Saturday clinic specifically. So usually patients get two visits, and if they have a chronic condition, including hypertension, hyperlipidemia, diabetes, asthma, or obesity, which is defined as a BMI of greater than 30, they will be eligible for 4 free visits at our clinic. And after that, we transition all of our patients into long-term care at the same location, Walton Family Health Center, where they'll be seen by a primary care physician at the Institute for Family Health for low or no charge. So visits there are sliding fee. They're on weekdays versus the student run clinic that's on Saturdays. And the sliding fee scale is at no risk of being taken to collections. Our on-site medical team. So every Saturday we have teams of volunteers and staff. This includes the third and fourth year students who are seeing the patients, our interpreters, patient advocates who are helping with our social determinants of health screening and setting patients up with different community resources. We have reproductive health and community ed volunteers, as well as referrals to various sites throughout the Bronx, which one referrals appointment is actually covered under Echo as also free of charge. We also have labs, front desk, back desk. And then on the staff side, we have attendings and nursing staff who help oversee all the visits, help draw blood from patients who need it. We have medical office assistants, as well as receptionists and janitorial services. Some of the services that we offer at Echo every week, we do physical exams. So all new patients will receive a comprehensive physical exam and primary care visit. We also have women's health visits, where while we will not see patients who are pregnant because our clinic is specifically for patients who are not eligible for any kind of insurance, we'll do pap smears and different women's health screenings. And then for pregnant patients or for patients who need more in-depth women's health visits, we can set them up with referrals to either primary care, family medicine clinics, or to OBGYN services. We also have civil surgeon visits where we have certified physicians on site on certain weeks who can help complete civil surgeon paperwork for those who need it. We offer HIV and STI testing as well as post-test counseling for patients regardless of what the status of that test was, and those who test positive are referred to long-term care at the Institute of Family Health. And regardless, all of our patients are also referred to the Institute of Family Health for long-term care. We also offer referrals to more specialty services. So all of our patients are entitled to a minimum of one referral, which can include anything from cardiology, OBGYN, gastroenterology, depending on what the patient's needs are when they come in. We also have labs and vaccines on site. We do have some vaccines available every Saturday, and those that aren't available, we will refer you to other sites where they can offer them for low or no charge. And we also collect blood work, urine, stool samples from patients who need them depending on what they come into clinic with. So In addition to all of these really comprehensive healthcare services that we offer, we have on-site groceries from Grassroots Grocery every Saturday where we get deliveries of fresh produce for our patients to take home with them and feed themselves and their families or their households. We have food pantry services for a more long-term connection to healthy food and grocery resources, and we refer our patients there every week. And we also have a domestic violence program for patients who need it. We're able to directly connect them with staff at the Domestic Violence Urban Justice Center who can help guide them and help them navigate that process. In terms of our community, we have really strong connections with community that is really spearheaded by both the outreach officer as well as our community educators. We attend health fairs. We do free mental health and nutrition seminars for both adults and in local schools. We offer after-school tutoring, after-school sports programs, including volleyball and soccer right now. And I know we're trying to expand that in the future. And we also have virtual reading programs for kids over the summer. So while our clinic doesn't see patients who are under the age of 18 specifically on the Saturday clinic, we can refer them to family care practices and primary care practices, either at IFH or other clinics, as well as offer these after-school type programs. And then in terms of funding, we're funded by the Robin Hood Foundation, which is our grant that provides IFH with funds to pay for the attendings, nursing, housekeeping that help us run our Saturday clinic and keep our clinic flowing. We also have volunteers from Einstein who staff the clinic, as well as some donations from our Echo Gala, which you can see a picture of on the screen. We host this every year as one of our many fundraising efforts, in addition to 5K runs, bake sales, sweatshirt sales, where we are able to raise money to help keep the clinic open. Thank you for listening to us and for inviting us to speak today. We are happy to connect any patients who you may come in contact with or any potential clients to the clinic. We are able to schedule appointments directly. So Ashley and I have access to Epic where we can book appointments for patients. And if they're not a direct referral, they can also call us at the number on this screen. We also have our Instagram linked here. We're open to scheduling appointments from 9 a.m. to 12 p.m. pretty much every Saturday that's not a national holiday. And patients can call and leave us a message, and someone will call them back within a week to help schedule an appointment. And then again, just some additional contact information. If you ever need to get in touch with Ashley or myself, these are our emails. So feel free to reach out to us at any time if you have any questions. Okay. So I'm not sure if my screen is still sharing, but I can call Sandy to make sure that there were no questions that are still unanswered.
I think it's still sharing.
Oh, okay. Hold on one second. In the meantime, let me call Sandy.
Hi, Ashley.
Hi, this is Taylor, actually.
I'm Taylor. I'm sorry.
That's
Thank
okay.
you so much for the presentation.
No,
I
thank
learned a
you.
lot,
I'm glad. Thank you so much.
and we will make sure the information is shown tomorrow and put in our minutes.
Okay,
Does
great.
anyone have any questions? Dr. Tutu, do you have any questions? What? I think she said you answered all of her questions.
Oh, wow. I'm so glad.
Um,
Okay, hi, I'm Joanne Rubino. I just wanted to, you mentioned, you refer all clients to long-term care?
Yes.
And so, I don't understand that. That would be a nursing home or?
So, sorry, that's actually a great question. So, when I say long-term care, I mean long-term primary care visits. So,
Okay, there you go.
all of our patients are transitioned into primary care. Thank you for clarifying.
About that.
No, that's okay. That was my fault.
and I didn't know, civil surgeon paperwork. What does that mean?
So civil surgeon paperwork is for migrants or immigrants who are looking to get documentation completed in the clinic. There's certain medical forms that need to be filled out for that. So you have to be certified in a certain way, and there are only special physicians who have this certification, and we have them at clinic on certain weeks. So we can have patients come in, and we'll have physicians on site fill out that paperwork for them.
All right, awesome. Thank you.
Yeah, thank you. Okay. I don't know why it won't let me stop sharing my screen.
I'm sure, yeah, when you leave the meeting, it would.
Okay, I just want to make sure before we hop off, because we actually have another meeting for the clinic today. Um, there are no outstanding questions, correct? Maybe just a thumbs up if I know you guys, I can't hear you. Okay.
Hi, is the
Perfect.
public allowed to speak?
Yeah, sure.
Oh, yeah, of course.
Okay. Yeah, I just wanted to thank you for the domestic violence component. As a survivor and an advocate for other victims, I think that um, we're sort of an underclass in a lot of places. And since there's more understanding than there was 21, 22 years ago when I survived my situation, there's still a whole lot more work that needs to be done in understanding the devastating effects that it can have on a person's health, mentally and physically. So thank you so much for adding that as a feature to care. You know,
Yes.
for the children of survivors, whether the survivor is male or female, like the mom or their dad, or let's say a grandparent, are the children included in that as well?
First of all, thank you for sharing that with us, and um, thank you for sharing your story. And I can understand how it would be helpful to have that integrated into care as someone who may have experienced that. Um, in terms of the children, I am not directly in charge of the domestic violence program, so we help refer the patients in. I get them set up with either a social worker or a case manager there who can help them kind of navigate their process with their children. I'm sure they're probably included in like the consultation, but I don't want to misspeak. I don't have a definite answer of whether or not like when they incorporate the children into that process, if that makes sense.
Yeah, no, actually it does, and it gives me another tool, you know, in my
Absolutely.
toolkit in case
I,
anybody, because my son's 31 and he's
yes.
not in New York right now anyway. But usually when people survive these situations, the children are young. They're either babies or elementary school age, and you know, there has to be more of a family component. It's excellent that whatever adult or adults coming out of a situation trying to survive get the help that they need, but very oftentimes the kids are in tow with
Yeah.
them. So I just wanted to, in case anybody needs it, I just wanted to be sure that, you know, they wouldn't be like sitting in some hallway somewhere,
No,
you know,
absolutely.
while the grown-ups are in with a social worker or whatever component of care they might need.
I completely understand that. And honestly, it's a great question. I'd be happy um, if you want to share your contact information either in the chat or you can email me. It's at the end of this presentation, which I believe Sandy or someone will either be distributing or it will be posted tomorrow. Feel free to send me an email and I can reach out to my contacts at the program and get back to you with a better answer to that question. So for anyone who needs it or any contacts that anyone on this call may know who they think that would be useful for. One, we are happy to connect you, and two, I think that would be a good resource and good information to have going in as well.
Thank you so much.
Absolutely.
And I just put our emails again, just in case.
Thank you, Ashley.
Yeah, of course.
And because I can't see the chat, if anyone writes anything, do you mind just noting that down also, Ashley, for us
Yeah,
later?
of
Thank you.
course. There hasn't been any questions, but even if there are any right now, feel free to email us if they do come up during the week or during the minutes tomorrow. Any questions, concerns, comments are welcome.
Any other questions before we hop off?
Thank you.
Thank you.
Thank you all.
Thank you for having us.
Thank
Your
you.
time.
Gave
It was
us a
great
wealth of
speaking to you.
information. Can you hear us now?
Yes, we can.
Oh, my phone is still on. Oh, you have it. Okay. I want to thank you so much.
Thank you guys. I will be passing, Sandy, I'll pass your contact information on to Ashley and we'll be in touch soon. So thank you for having us again.
All the best.
You too. Take care.
Bye-bye.
Bye.
Excuse me? She's going to, she's in the hospital, but every year they rotate.
Oh, a different position. Oh, is that Webex? You're on Webex? All right. Indulge me, lower the volume all the way on that, or mute it. Are you muted?
I pressed star six to unmute. I guess I probably tried star six again.
Sorry.
It has to be worked out.
Can you hear us?
Nobody's in there.
Can anyone hear
Okay,
us?
is there?
Yes, I hear you. I hear you. Cynthia.
Yes. Oh. But, all right, great.
That is good.
All right.
All right, good.
Hey, you have my email or whatever. If you need the numbers, I have them.
But she's muted, so we can't hear her.
Right. Okay. The next.
Sorry, guys, I hear you. I'm gonna mute again, just to let you know I'm here, okay?
Thanks,
Okay,
thank
Thanks.
Thank you. All right. Now we have our second speaker who will introduce herself.
Oh, sorry, I was waiting for there. Hi, I have a lot of familiar faces. I was at the board meeting, not too long ago.
Right.
So my name is Maria Races. I'm a program manager for a C2C Building Resilience in Youth. I have worked with Housing Solutions of New York. I also work with the Department of Mental Health. So the Department of Mental Health does, they do meetings with us, they coach us, and we always have to send reports.
The city or the state department of mental health?
Because city.
The city.
Yeah, I'm gonna verify, but did I say state?
No, you said mental health, and I'm just asking
Department of
which
Health.
one.
DOMH, the health, Department of Health. It's probably
OMA.
city.
Oh, it's not.
Yeah, city. So they do regulate us. We always they give us training, etc. So what we do is that we work with young people, 13 to 21. We work with some families. We work within the shelters. We also work within the schools. And what we do is we educate on the importance of taking care of your mental health. And after the education, we also work with the families. We begin doing workshops where we help them cope with stress. We help them cope with anxiety. If it's at the point where it's really severe, whether they have suicidations, we do have mental health providers that we do refer the young people to. And sometimes the families, if they need to do family therapy. Yes, what's the question?
Yeah, I wanted to know if you work with the schools directly. I don't know if I missed this.
Yes, we do. We have some schools. We have one on 179. We have an elementary and a high school on Morris Avenue. So what we do, we give them a copy of the consent because they're minors, so we need consent from the parents. Then we meet with the young person. We're doing an assessment, which is PH9. Then we, on the middle of the workshops, we'll do a GAD and another, I think it's a PH9, to see if they're still okay or if they need more assistance.
Okay.
My thing is, after COVID and coming back, a lot of kids
Yes.
experienced a lot of stress,
Mhm.
anxiety, etc.
And the problem is now, because if you notice a lot in the news, you hear about these adults going through all these mental health stages.
Yeah.
Now, what if at 13 to 21, we were able to support them
Yeah.
and maybe get the services that they need, or teach them how to cope with the stress and have them understand what mental health is, that it's okay not to be okay. At the same time, we try to educate the families. Mental health has such a bad stigma that it's like,
Yeah.
oh, you're nuts, you're crazy. No, it's stress, it's anxiety, and 13 to 21 is such a sensitive stage
Yeah.
that we're able to give them healthy skills to move further. We also, from 4 to 6 weeks workshop, we also give that $50 gift card initially.
Oh, nice.
They
That's
love
the way to
that.
do it.
So it keeps
Good.
them coming.
It keeps them coming, but we've had like, especially in our high school, we usually order pizza because we get them at lunch where they're a little bit more relaxed, and we have these entertaining workshops, and it's all about how that may be one of
that's
the
right.
coordinators. It's all about if you're stressed out and you don't want to talk to your parents, what are your coping skills? And we give them numbers. At the same time, while working with them, if they say, "Oh, but I just want to work," we would refer them to an organization that would show them how to work. I
What were
was
the ages again?
13 to 21. I was at World AIDS Day. I believe it was Jacoby. And we connected with the LGBT organization where we could also refer if they're struggling through their sexuality. Because like I said, 13 to 21 is like such an awkward, forgotten age. And sometimes they don't want to talk to the adults. Sometimes they don't want to talk to their teachers. So we go there, try to relate to them and try to teach
Do
them.
you go into every school, like every high school in New York City,
We
or
have-
are you limited?
Only Bronx so far.
Bronx schools. okay.
Yeah, we do have other BRY. It's not only in the Bronx, there are other organizations of another school. My goal is to work with the shelters because we have Housing Solutions of New York has other shelters in all 5 boroughs. We even have one in Staten Island. Most of our shelters are here in the Bronx. So we do go into the shelters, but then we also go into the schools. So far, like I said, I think we have 3 schools, one on Morris Avenue, one on 179, Coordinated Direction High School. And I wish I could remember the other one right now, which is pretty brand new, because in January, we're doing a parent conference where we want to explain to the parents what we're about and have them understand that mental health is okay, not SPK, and this is what kids go through.
Right. It's not only shelter kids, it's
Not
not any
Right.
kid.
Thank you.
No, but right now, we're Housing Solutions in New York, so we have shelters, so we
Right,
do
right.
work with them, but we also, like I said, we work with high schools. Promesa.org, I believe that's a youth organization, has just reached out to us, so we're working with them. We also work closely with the 40th Precinct, where they have a young ladies group, so we work with them also. I was there the other day for breaking bread with the mayor's office, so,
Okay.
yeah.
Because my granddaughter goes to school in she goes to Morrow High School, which is in Brooklyn. But a lot of those kids were experiencing, but then they went to counseling, but then the parents were paying for it. Big
Well,
time.
you know what? If you email me the address of the school, I could send another BRI around the neighborhood just to introduce themselves if they were interested, because this program is no cost to anyone. It's like I said, it's just an initiative to try to reach the young people before it gets to it.
Yeah, but what I liked is the young people knew they had a problem and they all
Right.
were sharing and they were all going, and the parents, you know.
Yeah, we don't push away parents if the parents want to learn or they want, like I believe I spoke to another parent who had a 7-year-old. We didn't turn her away, but we tried to get the resources for that 7-year-old while we worked with she had a 20-year-old and a 16-year-old. And a lot of the behavior issues is because of lack of knowledge of what the mental health is. So, they're like, oh, they're acting out. Well, let's talk about more, why are they acting out?
Talk louder so that we could record it.
Do you work with like student in alternative schools?
Yes. As a matter of fact, one of my goals is also reaching troubled youth.
Yes.
Because a lot of times they're acting out, there's something going on. There's something more
Yeah.
under that surface. That maybe because you have that 13 to 21-year stigma, those are kids will be kids, those are, those teenagers, and they have that awkward stage where they're not babies and they're not adults. They're in that really awkward stage of who am I? And so the parents treat them like they're adults, but then they want them to, scold them and stuff because they're children. So we try to get.
Do you work for screenings, like screening services,
What-
like if there is a troubled youth,
Mhm.
and you really can't reach that child, do you offer screenings?
We do every week meet with our mental health providers. So let's say we have a troubled young person, I think we would meet with them and they will direct us on what's the best practice to work with this young person.
Okay.
So, initial meetings are like the PHQ, which is like SI, suicidal ideations, drug and alcohol, the basic. And a lot of times you'd be surprised when you get into those questions with these young people, they do open up. We've had a few that just cry over the fact that when they're talking about their trauma, or they're talking about, yes, I did have these thoughts, or I did hear these voices, but nobody wanted to hear me talk about it. So we do get, if we're in a school, like we will need directions, we do get, if there's a red flag, we do get the social worker involved, and we do call the families, but we just don't leave them, you know?
Okay.
Even after the 4 to 6 week workshop, we'll continue work, they may not get the $50 again, but we'll
Yeah,
continue
yeah.
working with them, and we do really try to make these workshops fun.
So they're 4 to 6 week cycles.
It's a 4 to 6 week where the initiative, here's your $50,
Okay.
right? Thank you for coming. But if they say, hey, you know what, I don't want to stop coming. I enjoy these talks. I enjoy learning these coping skills. Can I continue? Yes. So let's say I do a one-on-one with another young person and not part of our organization. We have workshops in the schools, and then in the shelters, we do one-on-ones. We try to meet them where they're at. I believe we had 4 young ladies that meet at the library because, you know, they're friends. So they want to be with their friends. So we do a Zoom call. You know, first initial meeting will be individual because there's a private information, you know, HIPAA law. But then after a while, we'll just do a group and do a nice fun meeting. They don't realize that they're learning.
Right.
Do you have a liaison with ACS?
No, we don't have a liaison with ICS, but we
So,
know we are.
you are mandated.
We are mandated
Right.
to report it, so if
Yeah.
there is a red flag, yeah.
Okay.
Do me a favor, text me again or email me because I can't find it. Maybe
It's okay,
nobody bothers me, so
yeah.
I probably have your information somewhere else. but-
It's fine, but it's fine, but I'm just glad to be here now.
No, I'm glad.
I want to ask you about
Go ahead, louder.
the training with DOH. Do you get certified as an organization or how?
We,
does it go?
we are an organization, we are trained, now, it's what we are not therapeutic, we're not therapy, we're education.
Oh,
So we're in an education program, we'll sit with them. Now, we do get extensive training, we do go through this Moodle stage that the BRI, so there's a couple organizations that we go through the same training. If it's something that it's a lot for us to handle, we have the option of calling our MHPs. We do have social workers on hand and we do have mental health providers, but we're labeled as an education program. Because what we're doing really is getting to know them, and then we're trying to teach them coping skills. And so, you know, as adults, they don't have those coping skills, and our generation really doesn't have coping skills. You know, they have that quick set effect of the phone, the media. So when they get frustrated, they want to throw their phones. Let's teach them some coping skills. Why are you angry? Let's put the phone down. Why do you have anxiety? You know, what's the basis of anxiety? When you feel anxiety, where can you go? And, you know, we'll try to refer them if they have the anxiety because they want to work. So let's work on how to cope with the anxiety. And then at the same time, we have a young man with our work study program, we'll refer it to them. So we just don't leave them alone. We try to also outsource if they have other needs.
You work with the guidance counselors too.
Yes,
I
the
bet.
social
Yeah,
workers.
social workers and the guidance
Mhm.
counselors. I'm
They
a
refer
guidance,
them-
I'm a guidance counselor.
Yes, new direction. They have a little room that they refer the young people to us. And they're great because they'll take them from the classrooms and then they meet
Right.
with us. Yes.
Oh, very good.
So this is one of my coordinators.
Hi. Oh, sorry.
We do have she runs the Spanish workshops at New Direction.
Oh,
So, yeah, and she does the Spanish.
hi.
right.
And
So we need to, sorry, I'm in
Please sign in so that,
Just put, yeah, on that
just
side.
put it underneath. Because when you speak to the parents, it's a manual. Do not speak English. I don't
right, so a lot of,
It's like bilingual.
right.
But do you do other languages other than,
Okay, so
Spanish? Because
if it's any other language than Spanish, I'm Americanized, my Spanish isn't the greatest either. I do use Google. So if there's French, I will use Google. If there's any other language, I would definitely try to use Google or see if maybe even our mental health providers may know the language.
you like if Arabic or something like
Yeah.
that.
Yeah.
Just to interject, sorry.
It's okay.
Good evening. My
Okay,
name
let's just tell me,
Loud and clear.
my name is Juliana, pronouns is she, her, hers. I'm a C2C care coordinator. I work alongside Ms. Raices. When it comes to the evaluation process, when we evaluate the teams, we would use something like Google Translate if there is a language barrier between the teen and ourselves. However, when it comes to the workshops, because we're not fluent in any other languages besides English and Spanish at the moment, we don't offer the workshops to those said teens. However, if in the evaluation process we find that there's a red flag and they need therapeutical services, we do reach out to our partners and let them know, and they can assist us and let us know what the process would be for them to get therapeutical services at their with their language.
We are, one of our partners is Sun River Mental. So like I said, we meet with them weekly. I think the other time I spoke with them because I was dealing with 2 young men that had autism. And they would guide us, what's the best approaches, how to work with them, etc. And then we go from there. If we have a troubled teen, like someone mentioned, somebody said we have a troubled teen. We do go to them and we ask for their guidance, but we don't reject anyone for language or anything like that. Okay.
All right. No, but it's a great program. But the more you hear about it and the more and it's available.
We are planning, Gala, you're all invited in February. So I'll definitely send you the information.
Yes, and we'll make sure, like the Echo Gala.
Nice
they, you know, they
fundraise.
have to make
Yeah,
their
a
money.
little gala for, we're still up in the air with the subject, but we want to celebrate the young people that do work with us. Because, you know, like I said, they're lost, it's a lost age. I mean, we all remember when we were between 13 and 21.
Right. It is a lost age. And now, with all this immigration, people coming from all over, you have to expand. You have to expand. It can not only just be Spanish, it's gotta be other languages.
Well, you know what you could hope for is to get volunteers.
Yes.
Like say
Well, that's
in
true,
Little Yemen,
Yes.
you know, like I would know someone who would.
Yeah.
Right, because in Einstein, I'm not in Einstein, but in Jacobi Hospital, now like the main language, yes, is Spanish, but it's also Albanian.
Oh, yes.
It's a
Right,
very
yeah.
big Albanian population there, so a lot of patients that go.
I know there's a lot of French too.
Yeah,
Probably from Haiti.
yes.
Yeah.
We bump into French.
Yeah.
But you'd be surprised, the young people, if they'll try their
They pick
best.
it up.
Yeah. The struggle may be with the parents,
Yeah,
but we try our best. But the young people really try to speak to us in English.
I tell you the truth, because I know from my own great nieces and nephews, because they were living in Miami. My sister-in-law had someone come in to help her, and the kids picked up Spanish to this day. They know it.
Yeah.
And she goes, no, that my kids only speak English. But we said, no, when you're out, they
They
talk
speak
to her.
Spanish.
Yeah,
That's awesome.
because they are like sponges.
Yes. When they're young that way,
Yeah.
it's easier, they have a little bit more patience. And the fact that somebody's willing to sit with them, they try.
So it's 7:45, Sandy.
Yeah.
Oh, shoot.
Did you want to see if anybody had a quick question? Because we have
Right.
to go on to the
We have
next
to
meeting.
move on
Yes,
to our next one.
thank you for your time. Does anyone have any questions?
No,
We
just-
still have some people there. Okay.
Yeah.
Oh,
Thank you.
thank you for the presentation. It was very, it was full of information that I never knew. I'm sure you guys probably don't do anything specifically along the lines of domestic violence.
Oh,
But
no
if
problem.
I do hear of any families that are struggling and stuff, I will look up the information on the website. Can I refer you guys?
Sure. I mean, domestic violence is a thing with our young people too. So we do bump into that sometimes.
Oh, good. Okay, so that's another tool for the toolkit, because
Yeah.
no, sometimes they fall through the cracks. Like I said earlier to the other people that made the other presentation, very oftentimes because people don't understand the devastating effects that it has on families, in particular children. You know, I just want to make sure that kids get, or any kids I come in contact with, get the help that they need. And
Then this provide.
Yes.
thank you so much.
Thank you. Thank you, everyone,
wonderful.
for giving us the time and.
Richard. Thank you.
All right.
Thank you so much. And we will
Thank
be in
you
touch
all.
because we are also going to have a health fair
Yes, please.
in May.
Can I have your phone number just in case if you don't get my email?
Yeah.
And I could always.
Oh, yeah. that would be
I know,
great
I have it.
addition.
Yeah. Sandy,
Health
can I,
fair.
is it okay if I leave, if I end here?
Yes.
Yeah?
Okay.
Okay, thank you all for
Thank you.
coming.
Thank you.
December 10th, meeting adjourned at 7:47 PM. Thank you.
Leave me a message because if your name doesn't come up, I don't answer my phone.